So good evening to all of you. Okay, so we'll start. Hello, good evening to all of you. Yes, Naren, good evening. Okay, so I'll start now. We're starting with Ultra Rapid Revision course for the FMGE students. Okay, FMG students focused on 2021 batch. So topic for today I've selected is brachial plexus. The brachial plexus, understand the brachial plexus, understand the formation of brachial plexus, the relations of the brachial plexus, and the branches of the brachial plexus and its clinical importance. Okay, so now we'll start. To begin with, tell me now, what is a plexus? What is a plexus? Yes, all of you are there now, active. We'll start here. What is a plexus now? Plexus is a group of nerves. Plexus is a group of nerves. A plexus is a network of nerves. Network of nerves. And tell me, how's a plexus formed? Any plexus, how's it formed? Now we've got lumbar plexus, we have got cervical plexus, we've got brachial plexus, and we've got sacral plexus. So in general, how's a plexus formed? Now we're taking a section through the spinal cord. Just have a look at this. Yes, we're taking a section through the spinal cord, and just one moment. This is a section taken through the spinal cord. See now that. Tell me, what is this here? What is this? What is this? And what is this? This is a very important topic from the point of view of exams. Yes, so this is a section of the spinal cord. What do you call this as? Yes, this is the dorsal root. This is the ventral root. This is the dorsal horn. That's the ventral horn. And this is the spinal nerve. That's a spinal nerve. Okay. So I've taken a section of the spinal cord. The dorsal horn, that's the dorsal root. The ventral horn, that's the ventral root, and that's the spinal nerve. And now this spinal nerve would divide into two ramus. What is this ramus? This is the dorsal ramus, and that's the ventral ramus. Ventral ramus. So the spinal nerve divides into a dorsal and a ventral ramus. Now remember, as a rule, a plexus is always formed by the ventral rami of the corresponding spinal nerve. Clear? So plexus is formed by the ventral ramus of the corresponding spinal nerve. When I say corresponding spinal nerve, meaning what? The cervical plexus would be formed by the ventral rami of cervical spinal nerves. The ventral rami of C5 to T1 would form what? Brachial plexus. The ventral rami of the lumbar spinal nerves forms the lumbar plexus, and the ventral rami of the sacral spinal nerves forms the sacral plexus. So that's a general statement. A plexus is formed by the ventral ramus of the corresponding spinal nerve. Is this clear to all of you? So now what happens in thorax? In the thorax, there is no plexus in the thorax. So what will happen to the ventral ramus of? Complete the sentence. Yes, complete the sentence. What will happen to the ventral ramus of, we are in the thorax. So what will happen to the ventral ramus of a thoracic spinal nerve? Thoracic spinal nerve. Now there's no plexus in the thorax. So what will happen to the ventral ramus of the thoracic spinal nerve? Yes, anyone? Answer. What would happen to it? What will happen to the ventral ramus? Anyone? Answer. Now this ventral ramus runs in the intercostal space, and the same is what we now call as an intercostal nerve. Intercostal nerve, yes. So what is an intercostal nerve? Intercostal nerve is the ventral ramus of a thoracic spinal nerve. Ventral ramus of a thoracic spinal nerve, and in rest of the areas this ventral ramus is going to take part in the formation of a plexus. Is this clear to all of you? So once again, a plexus is formed by the ventral ramus of the corresponding spinal nerve. Now we're starting with brachial plexus. Have a look at this. Starting with the brachial plexus and answer this. So this is C5, this is C5, one minute. This is C5, this is C6, this is C7, this is C8 and T1. So what are these now? What are these? These are the ventral rami. So this is the ventral ramus of C5, ventral ramus of C6, C7, C8 and T1. In case of brachial plexus, this ventral ramus, we call them as roots. Roots. You understanding? So what are roots? Roots are the ventral rami of C5 to T1. Now the roots will join to form trunks. Trunks will divide into divisions. Divisions will join to form the cords, and the cords will give nerves or the branches. Okay, nerves or branches. Is this clear? So roots, trunks, division, cords and nerves. These are the parts of the brachial plexus. So what are roots? Roots are the ventral rami of C5 to T1. C5 to T1. Suppose if C4 takes part in the formation of brachial plexus, we call this as a prefixed brachial plexus. And suppose if T2 takes part in the formation of the brachial plexus, we call this as the postfixed. Postfixed means if C4 takes part, it is prefixed. If T2 takes part, it is postfixed brachial plexus. Postfixed. Okay. Okay. Why? What happened? What happened, Walker? Right. So that's it. Okay. So that's about the roots. So what are roots? Roots are the ventral rami of C5 to T1. I'm quite alive, right? So now C5 C6 joins to form here. C5 C6 joins to form the upper trunk. C7 continues as middle trunk, and C8 and T1 joins to form the lower trunk. Okay, so C5 C6 joins to form the upper trunk, C7 continues as middle trunk, and C8 and T1 joins to form the lower trunk. Now each of these trunks divides into divisions. Now each of these trunks would divide into divisions. Just have a look. I'll make this as the dorsal and dorsal divisions, and I'll make this as the ventral and ventral divisions. So each of the trunk divides into a dorsal and ventral divisions. Okay, now the ventral division of the upper trunk and the ventral division of the middle trunk joins to form the cord. Now what cord is this? The lateral cord. The ventral division of the upper and middle trunk joins to form the lateral cord. The ventral division of lower trunk continues as the medial cord, and the dorsal division of all the three trunks, joins to form the posterior cord. So that's how the brachial plexus is. Okay, it is quite easy. So roots are the ventral rami of C5 to T1, C5, C6, C7, C8, T1. C5, C6 joins to form the upper trunk, C7 continues as the middle trunk, and C8 and T1 joins to form the lower trunk. Each of these trunks then divides into a dorsal and ventral division. You can call it as anterior and posterior division also. The ventral is anterior and the dorsal is posterior division. So ventral and dorsal are anterior and posterior divisions. Now, the ventral division of the upper and middle trunk joins to form the lateral cord. Ventral division of lower trunk continues as the medial cord, and the dorsal division of all the three trunks joins to. This is clear to all of you till here? Yes, so this is how the brachial plexus is. Now we come to the root value. Understand the root value, which is always confusing. It's so easy. Have a look. What is the root value of upper trunk? C5 and C6. C5, C6. That's upper trunk. Root value of middle trunk would be C7, and lower trunk would be C8 and T1. C8 and T1. So that's the root value of the lower trunk. So what will the root value of lateral chord be? Lateral chord would be C5, C6 and C7. Understanding? The root value of medial chord would be C8 and T1. And the root value of the posterior chord will be, posterior chord is formed by all the dorsal divisions. So this would be C5 to T1. Is this clear to all of you? So that's how you get the roots of the chords. Is this clear to all of you? Yes. So now proceeding further, the last thing are the nerves or the branches of the chords. Nerves or the branches of the chords. So now what are the branches of, I'll start with this. What are the branches of lateral chord? Okay, we'll start. Have a look. Now, what are the branches of lateral chord? The branches of lateral chord would be, one is the lateral pectoral nerve. Lateral pectoral nerve. Any idea what is this lateral pectoral nerve going to supply? It supplies the pectoralis major. Yes, pectoralis major, the lateral pectoral nerve. Second, lateral root of median nerve. Lateral root of median nerve. Yes, very good. And the third one is musculocutaneous. Musculocutaneous nerve. So lateral pectoral nerve, lateral root of median nerve, and the musculocutaneous nerve. Very good. And all this will have root value of C5, C6 and C7. C5, C6, C7. Very good. C5, C6, C7. Now coming to the medial chord. Medial chord. So what are the branches of the medial chord? One, medial pectoral nerve. I'll just write this for you. Medial pectoral nerve. You can answer. Medial pectoral nerve. So medial pectoral nerve pierces a muscle. What muscle does it pierce? If you can answer this. Medial pectoral nerve pierces a muscle. Yes. Medial pectoral nerve pierces a muscle. That muscle is pectoralis minor. Medial pectoral nerve pierces the pectoralis minor and goes to supply the pectoralis major. Okay, it pierces the pectoralis minor. Second is the medial root of median nerve. Medial root of median nerve. So the medial root of median nerve is a branch of medial chord, and the lateral root of median nerve is a branch of lateral chord, and these two roots will join to form the median nerve. You clear? So how is the median nerve formed? By two roots, the lateral root of median nerve and the medial root of median nerve. So lateral root of median nerve is a branch of lateral chord. Its root value is C5, C6, C7, and the medial root of median nerve is a branch of medial chord. So its root value is C8 and T1. You clear? So the root value of median nerve would be C5 to T1. All the roots C5 to T1. The third is a nerve which supplies the skin here. What is this aspect of the arm? This is the medial aspect of the arm. So this is what we call as the medial cutaneous nerve of arm. Medial cutaneous nerve of arm. The next is medial cutaneous nerve of forearm. Medial cutaneous nerve of forearm. So what is the root value of all this? It is C8 and T1. C8 and T1. These are the branches of medial chord. And what is the root value of medial chord? C8 and T1. So all these nerves will have root value C8 and T1. And the last nerve is ulnar nerve. And the root value of ulnar nerve ideally should have been what? The root value of ulnar nerve ideally should have been C8 and T1. But this ulnar nerve receives a branch from the lateral chord having C7 roots. So this is C7, C8 and T1. C7, C8 and T1. You clear? Yes, lateral cutaneous nerve forearm is a continuation of musculocutaneous nerve. That's right. So medial root of medial nerve, medial cutaneous nerve arm. Yes. at the medial cutaneous nerve forearm and ulnar nerve. So ulnar nerve is a branch of which cord? Medial cord. So what should the root value of ulnar nerve be? C8 and T1. But actually the root value of ulnar nerve is C7, 8, T1. So where does this C7 root come from? It comes from the lateral cord. Okay, it comes from the lateral cord. So that's how the root value of ulnar nerve becomes C7, 8 and T1. Is this clear to all of you till here? Now coming to the posterior cord. Posterior cord. Right. So now coming to the posterior cord, one moment. What are the branches of posterior cord? Okay, what are the branches of posterior cord? One. Yes. One. We go in sequence. One is the upper subscapular nerve. Upper subscapular nerve. If you can just tell me what does this nerve supply? Answer this. Yes, you can be interactive. Answer this. Upper subscapular nerve. What does it supply? It supplies the subscapularis muscle. Upper subscapular nerve supplies the subscapularis muscle. Okay, subscapularis. Second is the lower subscapular nerve. Lower subscapular nerve. This lower subscapular nerve supplies the subscapularis and, if you can answer this. Yes, the lower subscapular nerve supplies the subscapularis and, yes, I'm waiting. Answer. The lower subscapular nerve supplies the subscapularis and teres minor. No, it's teres major. Sorry, teres major. Teres minor is supplied by whom? Axillary nerve. So the lower subscapular nerve supplies the subscapularis and teres major. It's not minor, huh? Rajvi, it's teres major. Then third is axillary nerve. Axillary nerve. What does the axillary nerve supply? Yes, the axillary nerve supplies one, the deltoid, the teres minor, and it gives a cutaneous branch. And what does this cutaneous branch supply? It supplies the skin on the upper lateral aspect of the arm, and this is what we call as the upper lateral cutaneous nerve of arm. Upper lateral cutaneous nerve of arm. Okay, so that's axillary nerve. So axillary nerve supplies deltoid, teres minor, and it gives a cutaneous branch which is known as upper lateral cutaneous nerve of arm. The fourth is upper subscapular, lower subscapular, radial. The next is nerve to latissimus dorsi. Nerve to latissimus dorsi, also known as thoracodorsal nerve. Thoracodorsal nerve. Okay, nerve to latissimus dorsi, also known as thoracodorsal nerve. It supplies the latissimus dorsi. And the last nerve is the radial nerve. Radial. Okay, so these are the branches of posterior cord: upper subscapular, lower subscapular, the axillary nerve, and these three have got a root value of C5 and C6. The upper subscapular, lower subscapular, and axillary, that's C5, C6. Nerve to latissimus dorsi, the root value is going to be nerve to latissimus dorsi C6, C7, and C8. C6, 7, 8. Not Bell's nerve, my child. R.K. Krishna, it is not Bell's nerve. Bell's nerve is nerve to serratus anterior. Okay, so nerve to latissimus dorsi is the thoracodorsal nerve. The root value is C6, 7, 8. See, the first three C5, C6. The nerve to latissimus dorsi is C6, 7, 8. Easy to remember. And the radial nerve is a continuation of posterior cord. So radial nerve will have all the roots C5 to T1. All the roots C5 to T1. Okay, so radial nerve is a continuation of which cord of the brachial plexus? Posterior cord. So radial nerve has all the roots. The root value is C5 to T1. Is this clear to all of you? Okay, now what is the root value of medial nerve? This is what I want you to understand. See, medial nerve. How is the medial nerve formed? I'll just write it here for you. Medial nerve will be formed by two roots. One is the lateral root of medial nerve. Yes, long thoracic is the Bell's nerve. Yes. Lateral root of medial nerve and the medial root of medial nerve. Medial root of medial nerve. Lateral root of medial nerve is a branch of which cord? Lateral cord. The root value is C5, C6, C7. And the medial root of medial nerve is a branch of which cord? C8 and T1. So the root value of medial nerve is C5 to T1. Is this clear to all of you? So there are two nerves of the brachial plexus which have got all the roots. One is the radial nerve and the second one is the medial nerve. Is this clear to all of you? So these are the branches of the cords of the brachial plexus. These are the branches of the cords of the brachial plexus. Now coming to the branches from the roots. Branches from the roots. Okay, there are branches from the cords, there are branches from the roots, and there are branches from the upper trunk. So starting with branches from the roots, have a look at this. Branches from the roots. I'll just write this down for you. Branches from the roots. Starting first. So all this that I just told you are the branches of the cords. You tell me, one, C5. There's a nerve which comes from C5 root. What do you call this as? Now this is the nerve which supplies a muscle which causes retraction of scapula. Answer this. This is the nerve which supplies a muscle which causes a retraction of scapula. Which is that muscle? So there's an MCQ. Retraction of scapula is done by. Answer. I'm just waiting. I'm waiting for your answer. No, my child. No. It's not long thoracic nerve. Just tell me who does retraction of scapula. That's my question. Answer this. Who does retraction of scapula? So retraction of scapula is done by the rhomboids. The rhomboidus minor and the rhomboidus major. They pull the scapula. They cause a retraction of scapula. And which is the nerve supplying the rhomboids? It is nerve to rhomboids. Nerve to rhomboids. It is also known as the dorsal scapular nerve. Dorsal scapular nerve. Dorsal scapular nerve. Is this clear to all of you? So now we are discussing branches from the roots. The first branch from the C5 root is the nerve to rhomboids or the dorsal scapular nerve. The second is a nerve which arises from C5, C6 and C7. C5, C6 and C7 root. And this is the one which supplies a muscle which pulls the scapula forwards. And this movement is what we call as protraction of scapula. Tell me, which is the muscle which causes protraction of scapula? This is another MCQ for you. Protraction of scapula. Yes. Which is the nerve which causes protraction of scapula? Yes, Wasim. Very good. These are the nerves on the medial aspect of the scapula. Very good. Which is the muscle which causes protraction of scapula? Serratus anterior. Very good. Serratus anterior pulls the scapula forwards. That's the serratus anterior. And the nerve which supplies the serratus anterior is the nerve to serratus anterior. Right. Nerve to serratus anterior. And this is what we call as the long thoracic nerve. Long thoracic nerve. Long thoracic nerve. Yes. Yes, Rajvi, trapezius also causes, the middle fibers of trapezius causes a retraction, but the main muscles causing retraction are the rhomboids, okay? So, nerve to rhomboids arises from C5 root of the brachial plexus, C5 root of the brachial plexus, that's nerve to rhomboids, also known as dorsal scapular nerve, and from the C5, C6, C7 roots, that's the nerve to serratus anterior or the long thoracic nerve, Is this clear to all of you following this? Yes, is this clear to all of you? Yes, very good. And tell me now, there's one more nerve which arises from C5 root of the brachial plexus. I'll just clear this. I need some space here. So tell me, there's one more nerve arising from C5 root of the brachial plexus. Yes, what is that nerve arising from C5 root of the brachial plexus? There's one more nerve which arises from C5 root of the brachial plexus. I'll make it for you. Here it is. Arising from C5 root of the brachial plexus, and this is what we call as the accessory phrenic nerve. Accessory phrenic nerve. You know what is the phrenic nerve supply? Very good. What is the phrenic nerve supply? The phrenic nerve supplies the diaphragm. And what is the root value of phrenic nerve? What is the root value of phrenic nerve? Anyone answer this? What is the root value of phrenic nerve? Yes, answer whatever you know, you answer. Even if it is wrong, it's okay. Then we'll correct it. What is the root value of phrenic nerve? C3, C4, C5. C3, C4, C5. That's the root value of phrenic nerve. And there is an extra phrenic nerve. Very good. It's C3, C4, C5. C3, C4, C5. Yes, very good. And there's sometimes an extra phrenic nerve which is going to supply the diaphragm. Anything extra is known as accessory. And this is what we call as the accessory phrenic nerve. And this accessory phrenic nerve arises from C5 root of the brachial plexus. C5 root of the brachial plexus. Okay? Right. Clear? So what are the branches from the roots of the brachial plexus? One is from the C5 root, that's dorsal scapular nerve. From C5, C6, C7, that's the nerve to serratus anterior. Again from C5, that's the accessory phrenic nerve. Accessory phrenic nerve. Is this clear? And just one last thing, there are branches which arises from the upper trunk. There are nerves which arise from the upper trunk of the brachial plexus. Tell me, what are the nerves? There are two nerves which arises from the upper trunk of the brachial plexus. I'll come to this. Yes, there are two nerves which arise from the upper trunk of the brachial plexus. This is 1 and this is 2. So branches from the upper trunk, the last one left now, upper trunk. So what are the nerves which arise from the upper trunk of the brachial plexus? One supplies the supraspinatus and infraspinatus. And which is that nerve supplying the supraspinatus and infraspinatus? This is what we call as the suprascapular nerve. Suprascapular nerve. The suprascapular nerve supplies the supraspinatus and infraspinatus. And the second one is the nerve to subclavius. Nerve to subclavius. Very good. So this is about the brachial plexus. Okay, so from the upper trunk you've got two nerves. One is the suprascapular nerve which supplies the supraspinatus and the infraspinatus, and the second one is the nerve to subclavius. Is this clear to all of you? So that's about the brachial plexus. Now understand how the brachial plexus is placed. Okay, coming to this, how is the brachial plexus placed? So have a look at this slide. Just magnify this part for you. Okay, I'll start. Now what are the parts of the brachial plexus? Roots, trunks, division, cords and nerves, right? Roots, trunks, division, cords and nerves. Understand this now. This is extremely important. Where does the brachial plexus begin in? It begins in the neck. It begins in the neck and then it comes into the axilla. Okay, it begins in the neck and then it comes down into the axilla. So now half of the brachial plexus, if we take, see, this is the brachial plexus, right? So what is this part of the brachial plexus? These are the roots, right? These are the roots. Then this will be the trunks here, roots, trunks. These are the divisions here. These are the cords and these are the nerves here. These are the nerves. Okay, so roots, trunks, division, cords and nerves. Now if we take clavicle as the reference, this is the clavicle here. If we take clavicle as the reference, half of the brachial plexus lies above the clavicle. It is above the clavicle, and half of the brachial plexus lies below the clavicle. Below the clavicle. We take clavicle as the reference. So this is what we call as the supraclavicular part of the brachial plexus, supraclavicular part above the clavicle, and this is what we call as the infraclavicular part of the brachial plexus. So now understand which part of the brachial plexus is above the clavicle and which part is below the clavicle. Have a look. What are these now? These are the roots, these are the trunks, and these are the divisions. So the roots, trunks and divisions are supraclavicular. It's above the clavicle. Understanding this? It's above the clavicle. So the roots, trunks and divisions are supraclavicular. If you can understand this, what is this muscle? You tell me, what is this muscle? Identify this muscle. Yes, identify this muscle. I'm showing you with the pointer. Identify that muscle here. Yes, fast. And identify this muscle. Answer. Yes, this will be uploaded on the YouTube. This is a very important lecture. Try to understand everything. This is the sternocleidomastoid, right? That's the sternocleidomastoid. What is this muscle here behind? That's the trapezius. Trapezius. This is not scalenus anterior. What I'm showing you is the sternocleidomastoid. This is the sternocleidomastoid. This is the trapezius, and this is the clavicle. Where are we? Where are we? Sternocleidomastoid, trapezius, and the clavicle. Where are we? Where are we? What is this area? This is the posterior triangle of the neck. Posterior triangle of the neck. That means what I want you to understand is the supraclavicular part of the brachial plexus, which is made up of roots, trunks, and divisions. Where does it lie? It lies in the posterior triangle of the neck. Posterior triangle of the neck. Behind a muscle, you can see this behind the sternocleidomastoid. That's the muscle here. Very good. And what is this muscle? This is the scalenus anterior. This is another very important visual slide for you also. Okay, so be clear about this. And this muscle is the scalenus anterior. And how do we know that this is scalenus anterior? Because there's a nerve. There's a nerve. Look at this nerve which lies on the scalenus anterior. Guess this. Which is the nerve lying on the scalenus anterior? Guess this. This is just what I told you some time back. The nerve which lies on the scalenus anterior, and this is the nerve which goes to supply the diaphragm. Answer now. Yes, very nice, very nice. That's the phrenic nerve. Very good, very good. That's the phrenic nerve. So the phrenic nerve lies on the scalenus anterior, and this is how we identify the scalenus anterior, because the phrenic nerve lies on it. And who lies behind the scalenus anterior? The brachial plexus. And what is this artery? What is this artery? This is the subclavian artery. So the brachial plexus and the subclavian artery lies behind the scalenus anterior in the posterior triangle of the neck. Am I clear to all of you? So that's about the supraclavicular part of the brachial plexus. That we'll see somewhere else when we discuss the posterior triangle of the neck. Okay. Now coming down, what is this part of the brachial plexus? Understand this now. What is this part of the brachial plexus? This is the infraclavicular part of the brachial plexus. Infraclavicular, that means it lies below the clavicle. Infraclavicular part of the brachial plexus. And tell me, what is the infraclavicular part of the brachial plexus made up of? The cords and the nerves. The cords and the nerves. So the cords and the nerves are infraclavicular. Are you all following this? Cords and nerves are infraclavicular. Where do they lie? Where do they lie? Where do the cords and the nerves lie? Just see if you can understand this slide. This is a very important visual also. Have a look. Identify this muscle. Chalo, identify this muscle which is cut here. If you can answer this. What is this muscle which is cut here? Try to identify this. This big muscle which is cut here. That's the pectoralis major. That's the pectoralis major, right? And what is this muscle now, which lies below the pectoralis major? I'll make this here. It is cut here. A muscle which begins from the ribs, 3rd, 4th, 5th ribs, and the muscle which is inserted on the coracoid process. What is this muscle? Answer. That's the pectoralis minor. Pectoralis minor. Very good. So what have we done? We've cut the pectoralis major. We've cut the pectoralis minor. And what is this muscle? If you can identify this muscle for me. This muscle begins from the first costochondral junction, and it is inserted into the clavicle. On the inferior surface of clavicle, what is that muscle attached to the inferior surface of clavicle known as? Answer this. Easy. Inferior, therefore subclavius. Okay, this muscle is a subclavius muscle. So where does the subclavius muscle begin from? It begins from the first costochondral junction, and it is inserted on the clavicle. So what I'm telling you is, look, we've cut the pectoralis major. Yes, very good, subclavius it is. We've cut the pectoralis major, we've cut the pectoralis minor here, and we've cut the subclavius. That means, what have we cut? What have we cut? What is this that we have cut? If you understand this, you'll be able to answer plenty of MCQs here. So we've cut the pectoralis major, we've cut the pectoralis minor, and we have cut the subclavius muscle. That means, what have we cut? We've cut a boundary of something. We have cut a boundary of guess this. Chalo, you can guess this. We have cut the boundary of something. Yes? You can guess. Even if it is wrong, it's okay. We have cut the pectoralis major, we have cut the pectoralis minor, and we have cut the subclavius. That means we have cut the axilla. This is the anterior wall of axilla. Indirectly, what am I telling you? The anterior wall of axilla is formed by 3 muscles: pectoralis major, pectoralis minor, and the subclavius. Are you understanding? So what have we done? We have cut the anterior wall of axilla. And what are we looking into? What is this that we are looking into? This is the axilla. This is the axilla. We have cut the anterior wall to see the axilla. So what I want you to understand is, where is the infraclavicular part of the brachial plexus lying in? It lies in the axilla. Is this clear to all of you? And what is the infraclavicular part of the brachial plexus made up of? The cords and the nerves. So understand this, the cords and nerves are infraclavicular. Where do they lie? They lie in the axilla. Is this clear to all of you? This much is clear? They lie in the axilla. Is this clear? And they lie around what? What do they lie around? Who's this? This artery now. Identify this artery now. What is this artery here? This is the axillary artery. Axillary artery. So the infraclavicular part of the brachial plexus lies in the axilla. The infraclavicular part is made up of the cords and the nerves, and it lies around the axillary artery. It is put in a sheath. Another MCQ for you. The axillary artery and the brachial plexus is put in a sheath. Identify. Name the sheath. Name the sheath. Answer this. You should know. Yes. 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 Yes, Raj Ravi. Yes. It is put in a sheath. Answer this. I'm waiting for your answer. You can guess. You can guess. It's absolutely fine. Even if it is wrong, it's okay. And then you'll understand what mistake you made. Axillary sheath. Yes. Excellent. Excellent. Yes, Raj Ravi, that's axillary sheath. So the axillary artery and the brachial plexus in the axilla are put in a sheath which is known as the axillary sheath. Remember, the axillary vein does not lie in the axillary sheath. The axillary vein is outside the axillary sheath. It lies out of the axillary sheath. Just remember this. So contents of the axillary sheath is going to be the axillary artery and the brachial plexus. Brachial plexus. Tell me now. This is the axillary artery here. This is the axillary artery, and this axillary artery is divided into three parts by whom? This axillary artery is divided into three parts. I'll come back to this for you. Just have a look at the slide. I'll just make a slide for you. Look. If you can understand this, I made this as the first rib. This is the first rib. Oh, I'm so sorry. Just come in the. This is the first rib. This is the first rib that I made for you. And the moment who's going to cross the first rib, look, this artery, it crosses the first rib, and that's now the axillary artery. So what is this artery? This is the subclavian artery, and the subclavian artery, the moment it crosses the first rib, it is now known as what? Axillary artery. After it crosses the first rib, it is now known as the axillary artery. And this axillary artery is divided into three parts by a muscle here. This muscle I've just shown you, and this is the pectoralis minor. Yes, this is the pectoralis minor. Look at that. That's the pectoralis minor. I just showed you the pectoralis minor. It begins from the third, fourth, and the fifth rib, and it is inserted on the coracoid process. That's the pectoralis minor, and this axillary artery is divided into three parts by whom? The pectoralis minor. So now if you can just tell me what is this part of the axillary artery before the pectoralis minor? First part. That means the first part of the axillary artery extends from the first rib to the muscle. The second part of the axillary artery lies behind the muscle, and the third part of the axillary artery lies after the muscle. Is this clear? That means the axillary artery is divided into three parts by whom? The pectoralis minor. Now I'm telling you the relations of the brachial plexus. Just try to understand this. So who surrounds the axillary artery? The brachial plexus. Which part of the brachial plexus? The infraclavicular part of the brachial plexus. The infraclavicular part of the brachial plexus and the axillary artery, they lie in the axilla. They are enclosed in a sheath. What is that sheath known as? Axillary sheath. This much is clear to all of you. See, I'm just repeating it again and again so that things will be perfect. So now you tell me, what are we going to get in the first part and in the second part? In the first and the second part of the axillary artery, we get the cords. Okay, I'll just write this for you. The cords are present in first and the second part. Cords are present in the first and the second part of the axillary artery. Yes, very good. Axillary artery. So cords are present in the first and the second part. And what do we get in the third part? Nerves in the third part. Be very clear about this. This is a very important concept. Nerves in the third part. Very good. Very good. So we've got three parts of the axillary artery. The first part, second part, and third part. First part is before the muscle, second part is behind the muscle, and third part is after the muscle. Clear? So what do we get in the first and the second part? Which part of the brachial plexus do we get in the first and the second part? The cords. And what do we get in the third part? The nerves. That means if you have to search any nerve which is a branch of the cord, the branch of the cord, all the nerves will be lying in which part of the axillary artery? The third part. Is this concept clear to you? All the nerves which are branches of the cords, not the branches of the roots, not the branches of the trunk, they will be in the neck, no? So the branches of the cords will be lying around the third part of the axillary artery. So what do we get in the first and the second part? We get the cords. The nerves in the third part, the cords in the first and the second part. Okay, very good. And understand this statement. This is a very, very important statement. The cords are placed according to the names in which part? The cords are placed according to the names in which part? What is the meaning of this statement? This is an extremely important MCQ. The cords are placed according to the names in which part of the axillary artery? Understand. Where do we get the cords? We get the cords in the first and the second part of the axillary artery. This is clear. And the cords are placed according to the names. What is the meaning of this? We have got three cords: lateral cord, medial cord, posterior cord. So lateral cord is lateral to the artery, medial cord is medial to the artery, and posterior cord is behind the artery. In which part? Second part. This should be perfect. So cords are placed according to the names in the second part. I'll just write this for you. Cords are placed according to the names in the second part, right? So cords are placed according to the names in the second part. So what do we get in the first part? First part also we get the cords, but they're not placed according to the names. They're just randomly placed. Okay, they're just randomly placed. So where are we sure that this is the lateral cord, this is the medial cord, and that's the posterior cord in the second part? Like suppose you become a surgeon and you are operating on the lateral cord of the brachial plexus. Fine, you're operating on the lateral cord. So you reflect the skin, you reflect the superficial fascia, the deep fascia. What is the muscle that you're going to see right now? After you remove all this, you're going to see the pectoralis major. Just try to imagine this. You're going to see the pectoralis major right in front of your eyes. Now you reflect the pectoralis major, and what are you going to see now? The muscle, pectoralis minor. And the moment you reflect the pectoralis minor, what is that part of the axillary artery that you're going to see? The second part of the axillary artery, and the cord which is lateral here in the second part has to be lateral cord. Is this clear? This is the meaning of the statement. So the cord which is lateral in the second part is lateral cord. The cord which is medial in the second part is the medial cord, and the cord behind the second part of the axillary artery is the posterior cord. This is the meaning of the sentence, and that's an MCQ. The cords are placed according to the names in the second part. Okay, right? So in the first part also you get the cords, but they're not placed according to the names. And in the third part, we get the nerves, the branches of the cords. Are you all following this? Yes? Is this clear to all of you? Okay, just look at this slide once again. So this will be clear to you. Have a look. Now tell me. Once again, just have a look. Tell me, what is this part of the axillary? What is this muscle that I'm showing you? What is this muscle? The pectoralis minor. That's the pectoralis minor. So what is this aspect? This is the lateral, this is the medial, and behind it is going to be the posterior, right? Very good. So what is this cord now? What is this cord? Answer. This is the lateral aspect. That's the second part of the axillary artery, because this is the pectoralis minor. So that's the second part of the axillary artery. So what is this cord? Lateral cord. What is this cord? Medial cord. And behind is going to be the posterior cord. You understanding? And what are these? These are the branches of the cords. So which is this cord, lateral cord. So this will be the branches of the lateral cord. So all the branches of the lateral cord, these are nerves, no? So where are we going to get the nerves? In which part of the axillary artery do we get the nerves? Third part. Okay, we get the nerves in the third part. So which cord is this? Lateral cord, and these are the branches of lateral cord. So all the branches of lateral cord will be present in the third part on the lateral aspect. Are you following? All the branches of the lateral cord would be present in the third part on the lateral aspect. What is this cord? Medial cord, and these are the branches of medial cord. So all the branches of medial cord would be present in the third part on the medial aspect, and all the branches of posterior cord would be present in the third part on the posterior aspect. I'll explain this, don't get confused. See, for example, you are searching the musculocutaneous nerve, right? Now see, simple it is. You are searching the musculocutaneous nerve. Where do you search this nerve? It's a nerve. So where are we going to get this? It's a nerve, so third part. Fine, this is clear. It's a nerve, so we are going to get it in the third part. You just have to know it's a branch of which cord. It's a branch of lateral cord. So where are we going to get the musculocutaneous nerve? In the third part on the lateral aspect. Are you following this? Okay, one more example. Ulnar nerve. Where are we going to get the ulnar nerve? See, first thing, it's a nerve. So where will this be? Third part. Okay, third part of the axillary artery. It's a nerve, so it will be in the third part. Ulnar nerve is a branch of which cord? Yes, ulnar nerve is a branch of medial cord. There should be no mistake in this. Ulnar nerve is a branch of medial cord. So where are we going to get this ulnar nerve? In the third part on the medial aspect. Okay, that's the ulnar nerve. And where are we going to get the radial and the axillary nerves? In the third part on the posterior aspect. Is this clear to all of you? So that's how you understand the brachial plexus. So all the branches of lateral cord will be in the third part on the lateral aspect. All the branches of medial cord would be in the third part on the medial aspect, and all the branches of posterior cord will be in the third part on the posterior aspect. So that's how you understand the brachial plexus. Yes, that's about the brachial plexus. And this brachial plexus, the infraclavicular part of the brachial plexus, is made up of cords and nerves, and this infraclavicular part of the brachial plexus lies in the axilla, around the axillary artery, enclosed in a sheath, and that is what we call as the axillary sheath. The cords are present in the first and the second part, and the nerves in the third part, and the cords are placed according to the names in the second part. That's the brachial plexus. I hope everyone has understood it and the entire concept is clear to you. Clear? Yes, fine to all of you. So that's about the brachial plexus. I'll stop here. Okay. Thank you. Thank you to all of you. And it was nice teaching you. It was a very good interactive session. I hope you've understood. I hope you've enjoyed it. Okay. Thank you.